The White House has officially released new guidance for nursing homes, including in those guidelines testing all residents and staff and continuing to test employees weekly. Also, facilities can only start allowing visitors in once again when they have shown no new cases of coronavirus for 28 days. There's also new data out showing just how tragically hard-hit nursing homes have been throughout this crisis. The Kaiser Family Foundation reporting that there have been more than 30,000 coronavirus deaths at long-term care facilities across 35 states. That's 1/3 of all of the total U.S. death toll from the coronavirus. Just tragic. Joining me right now, George Hager, CEO of Genesis Healthcare, one of the largest nursing home chains in the United States, operating in 400 centers across the country. Mr. Hager, thank you for being here. What do you make of
thanks
these?
For having us.
What do you think of these new recommendations from the White House? What do they mean for your facilities?
Well, clearly, opening up the nursing home industry is very different than opening up the economy. We are caring for and serving the most frail of our population that are extremely vulnerable to this virus. So from our perspective, the guidance is very prudent guidance from CMS and very cautious, making sure that we have adequate access to testing, to protective equipment, and to staffing. And clearly, as you stated earlier, the absence of the virus for a period of time so we can ensure the safety of our residents.
Do you have the capability of doing that level of testing today?
Kate, we really don't. Testing has been the key issue that we've been talking about for a couple of months since this pandemic started. You know, testing for the nursing home industry, unlike hospitals, many of whom have their own labs, we must rely on third-party regional or national labs to provide our testing. And at this point in time, both adequacy of testing supplies, as well as the capacity to test and turn around the results in the timeframes we need, has been a challenge. In certain states, it's been handled very, very well. I would point to Massachusetts, Rhode Island, and West Virginia, to name a few, who got out ahead of this. And we are seeing very good results from proactive facility-wide testing of residents and staff. But that testing ability is not consistent across all states, across all markets.
Well, and that's the thing. It's one thing to put out guidance, and it may be good guidance, but if you can't get there to actually get the testing done, guidance means bunk when it comes down to it if the federal government can't get to a place of helping getting those tests out there. What about the recommendation for allowing visitors back in? This is something so many families are curious about. Even with the requirement of 28 days without a new case before opening up, do you think you're ready for that?
Kate, I'll be very honest. Our advice will be very, very strong to be, safety as the first precaution here. Give you a personal anecdote. We just lost the founder of Genesis a couple of weeks ago to the virus. I had to recommend very strongly to his wife of 50 years not to go in and visit him before he passed away in a nursing home that he not only used to own, but also operate. So it comes close to home. We've lost our own employees. Every death is catastrophic to the loved ones of that patient in the nursing home. So we will recommend extreme caution before we open up our nursing homes to visitation.
I'm so sorry for your loss and for the entire Genesis family for that loss, not only of the founder, but also for all of the employees that are putting their lives on the line when they want to care for the most vulnerable. And so many, and families are so thankful for their work and what they do on a daily basis when they can't be there. The numbers, they just hurt to even say. 30,000 of the now 90,000 deaths are linked to nursing homes. At this point, and I know this is a complicated question and tough, can you say with confidence, Mr. Hager, that a nursing home is the safest place for the elderly in the era of the coronavirus?
I think by its nature, a nursing home, because it is a congregate setting, limits the ability to isolate anyone effectively. We have learned a tremendous amount for these last couple of months. We've learned better isolation protocols. We can quarantine new admissions. We have greater access to testing, even though it is still not adequate, and greater access to protective equipment. But just the congregation of that many people in a very confined space in a nursing home, with the amount of traffic, 100 to 200 employees coming in and out of the facility every day and going home to their families. Residents and patients going out of the nursing center for life-saving medical procedures, even new admissions from hospitals. What we found in research that has been conducted by both Harvard and Brown is it's the existence and the prevalence of the virus in the area around the nursing home that correlates to the greatest degree the exposure in the nursing home itself. So I can't say it's the safest. I can say it's a lot safer than it was at the beginning of the pandemic, and we're doing our best to eliminate any future negative outcome in the nursing homes that we operate.
Well, Mr. Hager, thank you for your time, and thank you for what you do in trying to keep your employees and all of the residents of your facilities safe. Thank you.
Okay, thank you very much.